There are three elements that are necessary to increase the hospital capacity. First are obviously the availability of the beds. A bed without staff is virtually useless, and a bed and a staff without the right equipment is virtually useless. So you have to complete all three at the same time. As far as beds, we have told the hospitals, I'm going to speak to every hospital administrator today, hospitals must increase their capacity by 50%. The goal is to ask them to try to increase it by 100%. Remember, we have 53,000 beds. We need 140,000 beds. Even if they did increase it by 100%, you'd only be at about 100,000 beds. You need 140,000 beds. Emergency hospitals like the 1,000-bed facility that's being built here will be helpful. The emergency hospitals that we're building at Westbury and Stony Brook and at the Westchester Convention Center will be helpful. But they're nowhere near the number of beds that we're going to need. I have no problem using the dormitories all across our state campuses, our CUNY campuses, our state university campuses. I'm speaking to hotel owners about taking over their hotels to put patients in. I will turn this state upside down to get the number of beds we need. But we need the staff for those beds. And we're calling and contacting all retirees in the healthcare field. We're calling all professionals in the healthcare field, whether or not they work in a hospital. They can work in an insurance company, a clinic, or whatever. But we want to enlist as many staff as we can and as many backup staff, because healthcare workers will get sick. And this is going to go on for weeks, and you can't ask a person to work for 14 days consecutive or around-the-clock shift. So we'll need a backup reserve staff.